Hi, it's Jessica DaMassa with WTF Health. What's the future health? We are talking to all sorts of different health tech companies about how healthcare is transforming in the wake of COVID-19. And no conversation about that would be complete without talking to these two guys right here. This is one of the biggest digital health acquisition deals of the year so far. So we've got Sean Duffy, the CEO of Omada Health, and Dan Rubinstein, the CEO of Physera. Guys, thank you so much for being here and agreeing to talk to me. It's great to see you. Congratulations.
Of course. Yeah. Happy to be on, Jessica. And thanks for the
Awesome. Great.
Thank you.
So, I mean, Dan, I guess let's start out. Let's talk about this acquisition because this was big news. I mean, so Omada building an empire here, pre-diabetes, diabetes. No, it's true. Pre-diabetes, diabetes, chronic condition management, hypertension, behavioral health. You guys acquired Lantern's assets a couple years ago. And we had talked actually at the end of last year in the fall, actually, about where you guys were looking next. And you were kind of cagey about your answer, but it looks like musculoskeletal was it. And so here we are. So yeah, so Sean, tell me a little bit about, what precipitated this move. It was one of those things that was kind of pretty well anticipated by the analysts in the market. We were joking around about Brian Dolan and exits and outcomes, talking about the fact that, either Omada or Livongo was going to jump first in terms of acquiring an MSK startup. And you guys are here. You've been here. You got here first. So tell me a little bit about this.
Yeah, well, I'll kind of set the stage and then ask Dan to chime in on top. So the Omada is a digital care company. Prior to joining forces with Physera, we operated in pre-diabetes, type 2 diabetes, hypertension, behavioral. And the mission has always been to create a world where in-person healthcare is option B. And that's not that in-person is not important, but rationally, you should try to solve someone's need from afar. Versus asking them to take time off at work, get childcare, show up to your waiting room, sit in your office. So that's been the mission. And the mission is balanced between what can be done clinically to best support access, value, scalability of care, and then what your customers ask for and what are their key healthcare challenges and needs. And persistently, musculoskeletal disorders rose to the top of both of those lists. It's a dramatically underserved care area. The potential for impact for the US and abroad is utterly enormous, and it's a persistent need in the market with our customers. So the belief was that it was a space that we could make a big impact in. And then the question is how. I think, as you know, Omada tends to take an orientation of making sure that everything we build aligns with our product principles of really blending the best of people and technology. And we spent careful time surveying the entire musculoskeletal landscape, fell in love with Physera, fell in love with Dan and the team, felt incredible, just imagining a world together. And so the rest is kind of history.
All right. I want to come back to that in a second because that is a very crowded field. So I want to ask more about that. But, Dan, I think talk a little bit about about what Sean kind of tiptoed around here about the opportunity for musculoskeletal. So you and I had a chat also. We spoke at the health conference at the end of last year as well. And I remember you telling me in our interview that this was one of the most costly aspects of healthcare as well. So can you talk a little bit more about that?
Yeah, I think in general, if you look at how much money the U.S. spends on musculoskeletal conditions, it's north of $200 billion a year. A lot of that is going, again, you have to understand in the context of the whole healthcare ecosystem. We have fee-for-service incentives, and because of those, we end up doing things that don't necessarily align with what's best for the patient. We tend to overtreat, more surgeries than are needed. We tend to do imaging many times when it's avoidable. Opioid prescriptions and opioid addiction rates are on the rise. And if you peel it back and you ask, well, how did we end up in this path and what can we do about it? Really, it's, there's clear guidelines from the CDC. Early physical therapy intervention is the right answer. And we just, we just don't do a good job as a country executing on that. So what Physera has done is essentially make it very easy to get convenient access to physical therapists who can triage you, diagnose you, prescribe personalized exercises, and then monitor you and make sure you're progressing it the way you should be through your recovery.
And I remember one of the things that was really impressive when we spoke, at least to me last time, was your adherence numbers. So say something about that.
Yeah, I mean, this is one of the failings of our current physical therapy. The way we do physical therapy in our country. You go to your physical therapist once a week, and then they give you these exercises to do. And whether you do them or not, it's up to you. And most people don't. They get a piece of paper, they just don't do their exercises. In our case, we actually monitor patients remotely with their permission and consent, of course. And so we know when a patient is doing the exercises and not. And our clinicians actually proactively reach out to patients to nurture them and encourage them and help them stay on track and develop the right habits to do the exercises they need to do to get better.
I mean, there's so much synergy here. I mean, in terms of just, I mean, and this is, you know, I mean, obviously, I mean, it's widely known that MSK was going to be like the next logical thing kind of from other chronic conditions. And, you know, oftentimes it is a comorbidity if somebody is, you know, does have diabetes or hypertension or whatever. So, I mean, I guess tell me a little bit more about what you guys are thinking the opportunity is going to be now that, you know, Sean, I'll start with you. Now that Omada has acquired Physera, you know, what's the opportunity going to be moving forward? Are you offering this as like, you know, full end-to-end solution to your clients right now? Like, paint a picture for me about like the near term, you know, how this is going to roll out.
Yeah, sure. So, you know, clients needs obviously come first. You know, if a client wants to just purchase our musculoskeletal capabilities through Physera, they can, you know, just type 2, just pre-diabetes. Yeah, what we feel from the market is a preference with partners that they trust to work across condition areas. I think that's just a practical reality, an obvious reality. Now the crux of it is you have to do a great job in each. So that's a piece of the strategic thesis. If we can go out to our partners that we've worked for many, many years, or partners to be, and really show our conviction on why Omada can be world-class in digital care in all these condition areas, the preference will be to work with us for simplicity and for user experience between them all. So that's you know, that's a bit of the strategic thesis, and that was pretty persistent. I mean, in our customer summits, you know, very, very early on, they talk, "Oh, we love what you do for our you know, our employees with prediabetes. Could you please do type 2?" And you know, the asks just kept coming, and this was persistent with musculoskeletal as well.
And Dan, how do you see it fitting into that? I mean, like, you guys have served a client base. I mean, I know we were joking a little bit earlier about the fact that, you know, you guys were invested. Your Series A, the lead investor in that was Blue Cross Blue Shield Ventures. You've got a big contract with Anthem. So how do you envision kind of augmenting kind of what you've built already, the success of Physera, and adding to the success of Omada?
Yeah, so I think one of the things that I really admired about Omada and Sean and his leadership team is both their approach, the clinical approach they take towards condition management, as well as their commercial success, both with health plans and with large self-insured employers. And frankly, when you talk to a lot of these employers, they don't want yet another point solution. You know, because it's healthcare, it's, you know, the sales cycles are long, the contracting overhead is long. So if we can simplify that for our customer and get to market faster, that's something that's very appealing through this combination with Omada. And I do feel, and it's also part of our vision. No healthcare company starts thinking they're just going to do one vertical. Everyone has ambitions to start in one space and cover others. And so I think that is the right solution for the market. And I think Omada has built best-in-class solutions for other conditions. And, you know, Physera, from a clinical depth, is the best-in-class offering out there in the market. And I think the synergies made a lot of sense coming together in one company with a similar approach to disease management and care.
Sean, I want to talk about that best-in-class that Dan just labeled Physera as.
Well, you know, I agree.
I'm sorry. I agree wholeheartedly. Of course you do. You're like, this is why I bought them. Mm-hmm. No, but I do want to talk about what was it about Physera in particular? Because that MSK space, we talked about it just a little bit earlier. You had said, you know, it is a crowded field. There are a lot of different startups out there that have different approaches. So what was it about them specifically, other than, you know, their great leadership team? What was it about them?
I mean, at the end of the day, I think the sustainability of vision in digital health requires clinical depth and an approach that is both pragmatic about what clinically can happen, but also blends the best in technology. You know, the Physera team had that in spades. I mean, the approach of leveraging incredible physical therapists that are licensed in their craft, you know, using technology mirrored exactly as we've done in other conditions. So we always say that digital care has to be made human. We have a mantra: digital care made human at Omada. Physera hit that vision, and it was the breadth of services, the actual product itself, the approach to amplifying the value and the credential of a licensed PT, and then the just cacophony of positivity from patients that have been through it, from their customers. I mean, you should hear how people glow about working with Physera. It's remarkable. And then, last but not least, it's the team. And it's, I think at the end of the day, the journey starts when you acquire a company. And the Physera team is an incredible blend of clinical specialists and technological specialists. And I think that I've always viewed my number one job at Omada, given that, my background is a mix of, I started at in medical school, but prior to that worked at Google and was in the tech world, is to bring together people from various disciplines and share that vision with Physera too.
That's interesting. I mean, I remember too, Sean, when we spoke earlier, one of the things I love that you had said was that you guys were building a full tech stack approach to healthcare. And I thought that was such an interesting way to describe it, because I think that that's often one of the things where there's like companies that are very focused on the healthcare part of it. There are some companies that are very focused on the tech part of it, but there's very few that do both sides really well.
Very few. Yep.
Very few. All right. So I have to ask this, Sean. We have to ask about the IPO. We have to ask, I'm sure I know what the answer is going to be, but I'm just wondering, we talked about this in the fall and going into this year, which has just been such a crazy year. I mean, and at JP Morgan, which is really, one of the last few times we had an opportunity to talk to, at least I had an opportunity to talk to a large group of investors. Everybody thought this year's big IPOs were going to be Amwell and Omada. So Amwell has filed. Is there anything you want to tell us, Sean? I mean,
well, look, Jessica, your job is to ask, and my job is to dodge. So we'll both do our jobs
Sean.
in all seriousness, you'll be the first to know the plan of record for Omada always starts with serving our customers, growing the business, expanding our condition areas, and the rest kind of takes care of itself. I always advise any entrepreneur who comes into the Omada walls, work to build the sort of business that could persist independently. And I think the journey is still beginning here. So no news yet, but you'll be the first to know.
I mean, this is a great growth opportunity. You got to finance that growth somehow. I'm just saying, Sean.
It's a transformational moment in digital care. I mean, this is a healthcare historians decades from now are going to be writing about this year as a year that capitalized and transformed digital health in the country.
I'll let you change the subject to that, but you've got to tell me, what do you think has been the most significant change? I'll let you. I want to go on record as letting you change the subject there. But talk to me about that. I mean, I'm curious from both of you, because you guys have both been involved. You both came out of tech, and then you both got into healthcare. And now in this health tech world, you guys have been around for a number of years. You've really seen an explosion in terms of, especially in both of your companies respectively, of growth, of uptake, of adoption. And here we are now, and because of the pandemic, I mean, things have accelerated at such a rapid pace, and not for the reason we really wanted them to, but regardless, here we are. So, when you talk about, Sean, like you say, this is probably going to be one of the most transformational years ever on record in this part of the industry. What do you think is going to be the singular most thing that has changed as a result of the pandemic?
Yeah, I mean, it's interesting. So when asked that question, a lot of people tend to point to regulatory changes. And I think those are important. Those are great. And I think some will be sticky, some will not. Hopefully many will. My view, the actual impulse that happened in the US healthcare system, in my view, is the fact that over the span of a couple months, we had every single citizen in the US ask themselves, can I get this needed care that I have to have without showing up in person? And if you look at all the regulatory responses are in reaction to that. And people like my mom who wouldn't be on FaceTime with their doc prior to COVID are now on. And I asked my mom, like, what's going to happen on the other side of this, Mom? Are you going to drive into the office of your clinician on the other side here? Are you going to ask to do video? She's like, no way I'm driving in this 40-minute drive. There's no way. So the magnitude of the consumer expectations shifting, I think cannot be overstated. It's because innovators like Omada, like Physera, we will rise to meet that need. And in the same time, in surfacing a lot of the opportunity in digital care here, it surfaced some of the inadequacy in that you can't get the job done in condition areas like we serve with just a synchronous video visit. Like the idea that that's the definition of success here, of like now you're connecting a licensed professional with a patient on video. That's the starting line. That's table
right. Table stakes. Yeah,
exactly.
Dan, what would you say in terms of like what's transformed? I mean, in terms of, I love how, don't look so scared. Yeah, and there's a lot to pick from here. I mean, but the regulatory, I think, environment is one of those things. And then like Sean said, the consumer sentiment around it, people who had never even thought about doing things digitally, all of a sudden are becoming, more comfortable and familiar, or at least aware of the fact that they can see a doctor, using their phone and using a telehealth platform. But what would you add to that?
Well, I think there's nothing like a crisis to focus the mind, right? And so I think things that we wouldn't have even considered previously all of a sudden, become the only way to do it. And then you realize, well, why didn't I just do this before? So, from our perspective, remote care, that was at the core of what our program was to begin with. It always made a lot of sense to me and my team, and our patients who used it were very delighted with it. And I'm glad it's terrible that the world had to come to this realization through COVID, but the benefit of this, I think this kind of acceptance will persist after the crisis has passed as well.
What are you guys hearing from your clients? I mean, I know you guys work with a lot of large employers, or you work with health plans. I mean, so what are you hearing from them? I mean, is the sentiment the same, that this is, I keep hearing, from very, overzealous entrepreneurs that, the flip has been switched, the genie's out of the bottle, we're never going back. Are you guys hearing the same things from the decision makers who are actually buying the health tech solutions?
Yeah, so we're seeing very clearly a number of very large employers and health plans accelerate their launching with us as well as their contracting with us. So there has definitely been and they're moving very, very quickly. So, health plans that we've been talking to for months, all of a sudden they want to meet next Tuesday, and when can we get going, right?
Funny how fast they can go when they need to, right?
It's been very refreshing from that. It actually feels like the tech world.
Do you think any of that's going to persist? Like any of the more rapid, I guess maybe more like the hunger to integrate technology into, because it's been there. And I think within the industry, people have been talking, to health plans since the beginning, or to provider groups or to hospitals since the beginning. But it's now there's actual no, there's a meeting, there's a contract, and it's happened in record time. Do you think that's going to persist as we move forward?
It's hard to say. I think. I hope it will, but realistically, I think we can really acknowledge that the COVID crisis has been the catalyst here.
Yeah.
Now, that being said, I think it has demonstrated to everyone that, if you want to make it happen, it can happen very quickly. So hopefully some of that will persist after as well.
Good.
Right. I also think in the same way that more people will be working from home just because they realize how much more productive they can be when they're not stuck commuting an hour each way. I do think there will be things here that will persist after the crisis has passed.
And I do, I echo Dan. I hope it does. Who knows? I think you have to, as an entrepreneur, grow comfort with the realities of how healthcare works, and the journey that you have to go on to innovate inside the system, not disrupt from around. It's not impossible. I will say that I think a lot of organizations have really seen how quickly they can innovate, and this was kind of a test case. So I was talking to one of our amazing plan partners who shared that in terms of turning on digital billing codes for their commercial book of business, in the span of 3 weeks, they made as much progress that they thought they would be able to make over years.
Wow.
So, per Dan's, comments, there's nothing like a crisis to focus the mind.
Yeah.
I love that, Dan, by the way. It's great. It's great. That's a great one. So,
it's going to get pasted on a wall at Omada Health.
Exactly. Turn that into, got to fold that into the culture. Fold
that into the culture now.
But people, everyone had to really innovate in the spirit of safety, appropriately. And I think the innovation continues. And to your comment, Jessica, the employers and plans across the country, they recognize that care has to be brought into homes now. It has to be. In diabetes, 50% of people are not getting the in-person care that they need. And so the challenge.
That's so high. I didn't realize that
50%, yeah, they've skipped an in-person care moment. So people are not going in to get their A1Cs tested. They're not getting the health maintenance behaviors that, doing the health maintenance visits that they should. So there's this headline behind the headline of these secondary health consequences that are going to come unless we find ways to get the care, to people. So, this is what Dan and I are feeling right now. Really an ask from our partners to bring care into the homes of their members and employees, recognizing that, it's a mandate right now.
What have you been seeing in terms of with the members of those plans, or the members of the employees of the employers? How has utilization changed, I guess, during this time period? I mean, are you guys seeing the uptick that a lot of other telehealth, remote care, remote monitoring companies are seeing?
Yeah, I mean, speaking for the past few months, I think it's a natural outcome of people being essentially stuck at home, or finally having the time. I think, yeah, actually, if you look at how much of our time is actually spent commuting or getting ready or going to the work, it's having that flexibility in your schedule to do things that you wouldn't normally have done has driven, we've seen an increase in utilization, certainly.
That's awesome.
Yeah, and I mean, for us, it's in addition, an increase in asks for support in new ways. So, I'll use kind of at-home A1C testing. We've had that capability. In large part, we've used it for research. Now in for instances where patients need it and they're nervous to go into the lab, we're like, well, we have that capability to do clinical research. Like, can we actually just get it into people's homes, so they don't have to go in? So it's really neat. Increased our product innovation in a neat way, because there's nothing like new user needs that you're listening to drive your product cycles. So we're seeing a lot of new asks, which are great.
Can you sneak preview us anything that might be coming out of the crisis that necessitated the innovation here? So
mention one. There's a lot of exciting stuff in the hopper.
Oh, sure. There's a lot of it, but we're going to hear
always the world. I am so proud of how Omada is blending continuous glucose monitors into our diabetes solution via our partnership with Abbott.
Okay.
That is really cool. We don't have to go into the depths here, but I think it stands to make a transformative impact on how diabetes care is done.
So you can tell you're excited. Look at that smile. Awesome.
That's one area I'm very excited.
One area. Okay. Dan, you want to comment too, or no? Are you guys?
Sure. No, I mean, one thing we've done in response to COVID is actually offer our program direct to consumer. So anyone in the country, regardless of health insurance coverage, can sign up for a program and pay out of pocket for it if, at a reduced discounted rate for COVID. So you can go to Physera.com/direct, and anyone, and if you happen to be an Anthem patient, your Anthem will cover it. But for everyone else, you can just pay out of pocket at a reduced rate.
All right, guys, last thoughts from you. What's going to happen next? I mean, and I don't want to talk about the next couple months, because I mean, this stuff everything is just changing. I mean, day by day. I mean, and even with the policy and the regulations around, telehealth, some of the things we were just talking before. I mean, it's this week that a lot of that is going to be reevaluated in DC about what's going to stay or what might not stay or whatever. But I mean, I think long term, how are you planning for the future? I mean, how are you planning for, for 2021, for 2022? I mean, what are you guys looking at now that Omada can offer, MSK in addition to all the other things that it offers, and Dan, in terms of continuing to grow? Sean, I'll start with you.
Well, I'll share kind of what I hope happens from a destination standpoint. So I've found, over the last 8 years at Omada, you get in these cycles where you're in these, you're going to these conferences, talking to healthcare executives, and a chunk of that and a chunk of the time and energy and innovation is talking about, the things that don't make sense and we wish would be true. The state-by-state reciprocity, digital billing codes, like all the things that, like, people gripe about those. And you quantify the mental energy that's spent complaining. I want to get behind that. So now, okay, great. The obvious things are taken care of. Let's talk about how to innovate better, because we have to reduce costs and have to increase value in the healthcare system. And care needs to not feel like care. The healthcare is the only vertical where someone engages with it expecting an operational burden on themselves, expecting a poor user experience, expecting a headache. We've got to get beyond that. So I have this dream that COVID is a forcing function, so we can stop complaining about the things that should never have been the case in the first place. And really thinking about how do we design the provider that should exist and should be there.
I love that, Sean. Dan, how do you follow that up?
Well, first of all, I completely and wholeheartedly agree with it.
Yeah.
One thing I would add to it, so let's talk about the substance of that care, right? And we can bucket it into things that require being in a hospital, things that require going in person, and this huge bucket, which is kind of under-resourced, underutilized today, of things that you don't need to go in person. And you can get treatment for a number of conditions without having to be seen in person. You can do it virtually through an app, through whatever modality that doesn't require the kind of the constrained resources of our existing healthcare system. So I'm excited about treating people with comorbid conditions. Looking at MSK, oftentimes it's not just an MSK issue. It could be a weight issue. It could be some other mental issue, and being able to treat all those holistically through our partnership and collaboration with Omada.
Agreed.
Awesome. Well, the future is bright, you guys. Congratulations again. Thank you so
much
much for the time. We'll have to check in with you in a couple months. Not nearly as long between the last time we've spoken, but I can't wait to catch up again and hear how this is going to pan out. Really exciting. And Sean, I can't believe you've managed to work your mother in. So you had another interview. So we're going to have to, for those who are watching, you're going to have to check out my interview with Sean from Health 2.0 Fall Conference, because there's the Sean Duffy's mom test. And maybe we should ask, did Sean Duffy's mom test Physera? Like, what did she think?
Physera absolutely passes the Sean Duffy's mom test.
Good. This is a technology test. If Sean Duffy's mom can use it passes muster at Omada. I love it. Well, thank you guys so much for joining me again. It was a pleasure to talk to you again. Congratulations. Sean's mom, hi again. Shout out to her. And everybody else who's watching, please check out the other WTF Health interviews that we've got up on our YouTube channel. That is just youtube.com/WTF Health, or you can find me at www.wtf.health. I'm Jessica DaMassa. Thank you so much for joining us. Thanks, guys. We'll talk to you soon.
Thank you.
Thank you.